Hello, my name is Dylan, and I'm the creative director here at Silicon Valley Orthopedics.
Hey, I'm Dr. Mossy Reynolds, orthopedic surgeon, sports medicine specialist, and co-founder of Silicon Valley Orthopedics.
And today we're here to talk about the shoulder, specifically.
Shoulder labral tears.
What is the shoulder labrum?
The shoulder is, if you think about the ball and socket joint of the shoulder, think about a golf ball sitting on a golf tee. And the tee is very shallow. And in order to deepen that socket or deepen that tee, that shallow tee, there's a gasket that goes around it, almost like an O-ring. It is there to provide some stability to a joint that is innately unstable.
Why is that important? Why does that matter?
In order to have the amount of range of motion in our shoulder, there has to be some level of instability, right? We sacrifice a little bit of stability to get that 360 degree of motion in the shoulder. Unfortunately, sometimes in athletics, sometimes just after a fall, we can dislocate our shoulder. And when that happens, the labrum around the socket gets torn.
Is there specific movements in sport that you see most common form of injuries happening?
Yeah, so sometimes you can get chronic, what we call peel back or tearing of the labrum, and especially my overhead athletes. So volleyball players who are serving, of course, baseball players, our surfers, a lot of overhead athletes, water polo, those are other ones as well. So if you're constantly reaching back and getting that overhead position, you're constantly pulling on the labrum, you can kind of tear it that way as well.
When someone tears their labrum, what are the symptoms that one can expect?
The acute tear, right? Like a dislocation, of course, that's pretty dramatic, and patients recognize it right away, right? Like no motion in the shoulder, a lot of pain and a lot of fullness kind of in the front of their shoulder. And typically they know right away that something isn't right. And so they'll either reduce it there on the field or wherever they ended up dislocating it, or they'll go to an emergency room or urgent care where they'll put it back in place and typically be held in a sling, and there'll be some, discomfort and swelling associated with that.
Okay, so Dr. Mossy, I'm an athlete. I'm a volleyball player, and I've been serving a ton, and I think I tore my shoulder labrum.
Yeah.
How do we diagnose this?
Multiple ways we can diagnose this. Clinical exam, of course, there's certain provocative examinations that we can perform to get a sense of whether or not you have a compromised labrum or a torn labrum or an irritated labrum. Most importantly is we should get an MRI of it, right? A magnetic resonance imaging, which shows us the soft tissue inside the shoulder. And especially if you're a volleyball player, there's other things that we're gonna wanna look at as well, but it'll show us everything. It'll show us the location of the tear, the size of the tear, if there is a tear, and then the characteristics of the tear as well. It's very detailed. There's, 95 to 97% sensitivity and specificity on the MRI. So yeah, I'm a big fan.
Once you have the full picture, you have the patient story, you have the x-rays, you have the MRIs, physical exams, how do we treat this?
I wish it was black and white and it's variable, right? There's so many different types of tears and every patient's a little bit different. And so we really want to customize the treatment to that patient specifically. And we always start as conservative as we can, even in dislocators. So first time dislocators who tear their labrum, we really want to try to avoid surgery. And so what we do is we maximize the patient's ability to strengthen around their shoulder to provide a stable environment for their labrum. So that's through physical therapy. Sometimes we can supplement with injections like platelet-rich plasma, bone marrow aspirate concentrate, mesenchymal stem cells, and things like that to get the labrum to kind of want to scar down and heal and create a better environment for that. So we want to try to avoid surgery if we can. The goal is to return quality of life and return to sport without surgery if possible.
Well, it's good to know that one has options when approaching treatment.
Always, yeah.
Okay, so if you need surgery, what does that route look like? What does the rehab look like? And what does the actual day of surgery entail?
For patients that fail conservative treatment, if they haven't improved with the non-operative modalities, then there are surgical options that have very good outcomes. And those are called Bankart or labral repairs. And we do it all arthroscopic. So we go through the shoulder with a scope. We look from the back and typically work through the front of the shoulder. And we put little tiny suture anchors in and around that labrum. We place that or repair that labrum and put it right back down to bone. Typically we have you in a sling for anywhere from 4 to 6 weeks, starting physical therapy right away to work on some range of motion. We increase range of motion to hopefully have full range of motion by 8 to 10 weeks post-op. And what I typically say is patients are about 80% recovered at 3.5, 4 months after a Bankart labral repair.
Awesome. Well, so thank you so much for all the information. If I have more questions or if I think that I have a torn labrum, what's next? What do I do?
Yeah, come on in. Give us a call at Silicon Valley Orthopedics and just let us know how we can help.
That was perfect. That was perfect. Yeah.
You can edit that one.